The latest numbers that came out today at noon show an increase of 1,857 cases across Louisiana. We're just shy of 15,000 cases now at 14,867. And very sadly, there are an additional 35 reported deaths. That's a total of 512. And if we can go ahead and put up the first, those numbers are reflected there. I do want to say again that while we report every 24 hours, it doesn't mean that the number of people that I just reported as having died in the last 24 hours. There is some lag in reporting, and sometimes people die and a test is pending, and it's not until the test comes in positive that death is then reported to us as a COVID death. And sometimes I think people are tested completely after they have died. And so we are going to try to start reporting, at least internally, the number of people who actually expire over the previous 24 hours so that we can take a look at that. And the reason that's important is, as I mentioned last week several times, the real numbers that we're paying most attention to about COVID in Louisiana aren't so much the testing numbers, but the number of hospital admissions and deaths. Because we know there are a lot of asymptomatic people out there. We don't know exactly what that percentage is that have COVID, but they're not going to be tested. But we know from data gathered here in the United States and in other countries, the percentage of people who should be so sick that they have to present to a hospital, and the percentage of the total number of COVID positive individuals who will die. And so if you have those numbers, then you have a better idea of what you're doing. We have completed it, and I want to thank Dr. Alex Bu and all the people across Louisiana, hospitals, clinics, but certainly the Department of Health. We've completed now just shy of 70,000 tests, number 2 in the nation per capita. And while we wish could have actually done more tests, and certainly we wish we could have done more earlier, the fact that we've been able to ramp up to that number of testing, I can tell you we have a visibility across the state of Louisiana that is pretty much unmatched across the United States. And as a result, as we get an idea of just how much COVID we actually have, the percentage of people being hospitalized and the percentage of people who are dying are getting much, much, much closer to the average, what you would typically see from other states and from around the world. Currently, there are 1,809 people who are hospitalized. 563 of them are on ventilators. And while all of the numbers that I just mentioned to you are still high, and they're higher than we would like, we are starting to see real signs that these mitigation measures that we put into place weeks ago are starting to bear real results. And we're hopeful that we're seeing the beginning of the flattening of the curve, and that these efforts are going to continue through additional compliance from people across the state. Now, we only have a few data points, and they don't quite constitute a trend yet, but we believe that we might be starting to see the beginning of flattening the curve. And that's what we believe, and so that's what I'm telling people. The fear is that I'm telling people that, and they're going to say, oh, the task at hand is accomplished. We can go back to doing whatever it is that we normally do and behaving as we normally would. That is exactly the wrong answer. And I say that because if we started the flattening the curve, it's only because of the mitigation measures. It's only because of the social distancing and the improved hygiene practices. And one thing that the president and the vice president, in fact, the vice president called me yesterday, and then we had another telephone conference today. One of the things he's pointing out is this need to stick with the mitigation measures, the stay-at-home order here, the social distancing, all the good hygiene all the way through the month of April. And he asked me to really stress that to people, and of course that is consistent entirely with what I would want to be telling you anyway. New hospital admissions are down. Now, that hospital admissions as a whole are up, but new admissions are trending downward. And as I mentioned to you before, the two numbers that you want to really pay the most attention to are the number of people going into the hospital each day with COVID, and the number of people who are dying each day with COVID. Of the people who are in the hospital, we have an additional 753 ventilators that we've been able to acquire over the last couple of weeks. And so we know that we're pushing out in time the day that we might potentially overwhelm our capacity to deliver health care, and that is a good thing. But a lot of this has to do with the great work being done in the hospitals themselves, because Louisiana doctors, these nurses, these respiratory therapists, they are doing some of the best work in the country right now, and I have no doubt that what I'm telling you is factual. I've been telling you that they are heroes because of the work that they're doing and putting themselves in risk of risking their own health in order to take care of others. But we now know that they are reducing the number of people who have to ever get on a ventilator in the first place, and they're doing a good job of decreasing the number of days that the average patient has to stay on a ventilator, and the number of days that they're actually staying in the hospital. All of these things get factored into our modeling as to when we might run out of beds and ventilators and so forth. And so it's the mitigation measures, it's the work being done in our hospitals, and it's the increasing of the hospital beds and the ventilators through the med-surg. All of this is taking place at the same time, and it's very, very helpful. Of the 753 ventilators that we have received in Louisiana, we have distributed 553 of them. 200 of them came in yesterday, and they are at the warehouse here in Baton Rouge. We will distribute those as needed soon. We also got a message that Arkansas is sending 5, and I just got off the phone with Governor Asa Hutchinson of Arkansas to thank him on behalf of all the people of Louisiana for their generous contribution to our state. So we bought ourselves more time that allows us to continue to be able to surge our medical capacity and continue to flatten the curve. And all of this stuff works in concert. And so we have to keep doing everything that we've been doing to have the best possible outcome. The data points that we've been seeing are only going to become a trend if we continue. So the mitigation measures, the stay-at-home order, the hygiene, social distancing, all very, very important. So now we have to keep it up. It's not the time to become lax and to ease up. And the Surgeon General has warned not Louisiana so much, but the entire country, that this is going to be a really critical week. It's going to be a difficult week when we see cases and deaths and so forth. So we have to stay focused on this. As for the question of whether we have actually peaked, it's obviously too soon to know for sure. Even Dr. Deborah Birx this morning on the White House call noted that weekend data is sometimes not as clear as what you get during the week. And so all around the country, the number of cases that were reported yesterday and the number of deaths that were reported yesterday are abnormally low. And that was borne out by the fact that we reported more today than yesterday as well. So we don't quite yet have enough data, but it looks like things might be moving in a positive direction. So we should be looking at this data very carefully for the next several days to come. And if we go ahead and put the second graph up there, I want to show y'all why it's important that we practice social distancing and good hygiene, and why it is that we have the mitigation measures in place, the stay-at-home order, and we've closed businesses and so forth, all of which are very difficult things to do, and we know we're asking people to sacrifice. But this is data that comes from Johns Hopkins, and the calculations are done by Dr. Gary Wagner of University of Louisiana Lafayette. And what it shows is that half of the top 20 counties, and of course we're the only state that doesn't go by counties, so it's parishes here, but half of the top 20 counties / parishes in the country, in the nation, with respect to COVID deaths per 100,000 residents, half of those are our parishes. St. John the Baptist, Orleans Parish, St. James, West Baton Rouge, Jefferson Parish, Plaquemine, St. Charles, Allen, St. Bernard, Iberville. 2 days ago, 6 parishes were on this list. So obviously we have a significant problem here in Louisiana. We've known this for some time now, and this bears it out, and it also reinforces the need to continue to do the things that we are doing, except to do them actually better, to have more compliance and not less. With respect to the information that we are sharing with you all, we're going to start showing more COVID-19 deaths on our dashboard at Louisiana Department of Health. Starting today, we're going to share aggregated data on race, the date of death, over time, and underlying conditions. As all this will be on the dashboard. That'll be updated not every day, but once each week. And you can see this at ldh.la.gov. And this is continued proof of our efforts to be as transparent as we can be about what the situation here is in Louisiana on the ground. And we want to also be as timely as we can be with the information that we provide to you all. Disturbingly, this information is going to show you that slightly more than 70% of all the deaths in Louisiana are of African Americans. Slightly more than 70%. And so that deserves more attention, and we're going to have to dig into that and see what we can do to slow that trend down. Hypertension is the leading underlying condition now for people who have died in Louisiana. And so for all these reasons, we have to continue to work this as hard as we can, be patient, be focused, be resolute. We're not far behind New York and New Jersey in terms of per capita cases. We make projections to help us plan and allocate resources because we have to be prepared, and we have to be prepared for the worst case scenario that is feasible. But we only get the worst case if people don't do what they're being asked to do, and that is to make sure that they're staying at home, don't go out unless it's absolutely necessary, minimize your social contact, practice good hygiene and social distancing. If you'd put up graph number 3, please. So New York is not on this. This is a chart that was shown to us today by the Vice President. And so the top line there is New Jersey. The green line underneath that is Louisiana. And so you can kind of see where we are as a state relative to all the others. And the reason New York isn't up there is because it is so much higher, both in terms of the number of cases and its per capita case count, that they left it off this particular one. But we're number 3 in the country, and what we need to see is, you can see that this crook, we need to see that actually turn flat and then over time come down. And that's exactly what we're looking to do. And the call I had with the Vice President yesterday, I was able to thank him for the 200 ventilators that were sent from the national stockpile. That decision was made Friday night, and they actually arrived in our warehouse over the weekend. I also thank the President for the federal testing sites that we had in New Orleans and Jefferson. 2 in New Orleans originally, 1 in Jefferson. The 2 in New Orleans were since combined because they played a big part in our ability to really ramp up our testing and to know more about the disease in Louisiana and how it was spreading. And those sites were scheduled to be closed on April the 10th by this Friday. He told me that if we wanted to keep them open, all I needed to do was make that request. And so I really appreciate that, and we do intend to keep those open. Another important update is that the New Orleans Convention Center medical monitoring station opened today. There are currently 23 COVID patients there. So basically, it's one of those wings. If you were there or if you saw it on TV, what we wanted to do is we want to make sure that we opened it, a soft opening, if you will, so that we could test the systems, make sure everything is working appropriately before we take a lot more patients. And so we have 23 patients there presently. This is a step-down facility. So it's not where anyone can go as a hospital to present with symptoms. You'll get, if you're going to go there, you're going to be transferred there from another hospital. And so nobody should be walking up to that hospital to get care, and nobody should be presenting to that hospital to visit with a patient either, because you're not going to be allowed to visit. And the purpose of it is to allow our Tier 1 hospitals to more frequently rotate their beds and to get people out of the hospital sooner than they otherwise would. And this is another measure that we're taking to try to surge our medical capacity. A note about face coverings, because I know that this over the last few days has become an area of interest to a lot of people. As you should know by now, the CDC recommends that people wear a non-medical mask when they leave home to protect each other from COVID-19. And what you're really doing, for the most part, is you're protecting others from yourself, should you have it. But if the others are actually wearing a mask, then they're protecting you. And typically, you don't need to do this if you're out exercising and you're going to be a long distance from other individuals. But when you're making those essential trips to the grocery store or to the pharmacy or to the bank or to get gas, and you're just going to have to be closer to other people than is recommended, then that is the scenario under which you would want to have a mask on. And it is still not recommended that you use an N95 mask, which remain in short supply for our doctors and nurses. We need to make sure that they get the medical masks, whether they're N95s or surgical masks, and individuals can use cloth coverings that are relatively easy to manufacture at home. And I want to thank the Attorney General. He brought me a pretty one today that's got the Louisiana seal on it. So I really appreciate that. Now, obviously, I'm not currently wearing a mask because I'm here talking to you all. But if and when I need to go out in public, let's say I'm going to go and look at a facility that we're going to be standing up as a medical monitoring unit or something like that, you will see me in a mask. And I think Alex has decided similarly to wear masks in that situation.